Hello, good afternoon. My name is Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to my weekend fertility clinic. So this afternoon, we're going to talk about what you need to do if pregnancy is not happening. So if you've always wanted to become pregnant, then after becoming pregnant, you give birth to your baby, then afterwards you become a mother, or you as the man will become a father, but it's not happening. What's the next thing to do? How do you actualize your objectives, your dreams of becoming a mother or becoming a father, especially if you are above 35? So that's going to be the basis for my presentation this afternoon. So I want to encourage you, when you join, feel at home. Make sure you can hear me clearly. Make sure you can see me clearly. I'm going to give my presentation. When I'm done with my presentation, you will have opportunity to ask all your questions. I'm here to help you understand what you need to do better. Today happens to be the second day in March, and March is going to be March into miraculous glory, gifts, and so many things God is going to do in our community. So I want to encourage you to come expectant. I want to encourage you to come with an open mind. I want to encourage you to activate your faith. You see, there are principally 3 tools you will need to become pregnant in the month of March, to become a mother in 2024, to become a father in 2024. 3 tools, 3 consistent, regular tools. You have to pray to God every second, every opportunity, every day, every week, every month, every now and then. Prayer works. Now, the type of prayer you have to execute has to be a positive petitioning prayer. You have to remind God that God promised He's going to make you a mother. You have to remind God that God promised He's going to make you a father. So you're not going to go, praying like someone that doesn't have hopes. No, you have to reactivate and unlearn and relearn the right way of praying. When you have said your prayers, then you have to do your own part. You see, God is not going to come down to get you pregnant. You have to make love. In our community, regularity is key. Regularity means every other day. Every other day means one day make love, one day have a break, one day make love. So every other day alternatively. So today is Saturday. If you made love today, you can break tomorrow. You can continue on Monday. You can break on Tuesday. You continue on Wednesday. You break on Thursday. You continue on Friday. You break on Saturday. You continue on Sunday. For the 31 days in March, I want it to be a love-making month. If you can do this, you have grossly increased the possibility of you defeating infertility and becoming pregnant in the month of March. Now, the last P is the one that so many people are actually not utilizing. You have to practice. Everything we do in life is all about practice. When you acquire knowledge and you don't, use the knowledge to change your life, it's a wasted knowledge. So you have to practice everything you've been learning from us. You have to know how to leverage on my presence. You have to know how to leverage on SGHS, on our videos, on our masterclass, on everything we've been pushing out there. If you can participate, you will overcome. So 3 important tools: pray, play, practice. But this evening, we are going to talk exclusively about the basic steps you can actually take to overcome long-term infertility and short-term infertility. So infertility is actually defined as the inability to succeed in achieving pregnancy, despite the fact you are making love with your partner regularly for a period of 12 months if you are below 35, or a period of 6 months if you are above 35. So if since 2023, January 2023, and up to March 2024, you have not succeeded in becoming pregnant and you've been making love, you've been praying, you've been practicing, then my sister, my brother, you guys have infertility. The question is, what type of infertility do you have? Do you have primary infertility? Do you have secondary infertility? When you have primary infertility, it means in your entire life, you've never been pregnant. When you have secondary infertility, it means together with your partner, you guys achieved pregnancy in the past, but currently pregnancy is not happening. So you can either have primary infertility or secondary infertility. Now, the first thing which every member of this community should get used to doing is to seek appropriate medical advice. You see, in our contemporary society, there are so many people that will advise you when it comes to having babies. It can be your mom, it can be your grandmom, it can be your auntie in the village, it can be your pastor, it can be your pastor's wife, it can be your neighbor. They will tell you, I've gone there, I've gone here, it's working, come, let's go. Don't listen to anybody. Trust me, don't listen to them. Once you have passed through 6 months, you are 35 years and above, no pregnancy, you are 35 years below, 12 months, escalate. You need a medical advice. You need to consult with a fertility specialist. A fertility specialist is a doctor that trained as a medical doctor, went for youth service, went for special training, went for specialty course, and decided that after getting OB-GYN certification, that he's only going to focus on helping couples that have infertility problem. That's the type of doctor you need. You don't need any other type of doctor. So you need to consult with this fertility specialist. When you consult with the fertility specialist, or if you guys don't have a fertility specialist, you consult with a gynecologist. So a gynecologist, depending on your location, if you have access to a tertiary center, go straight to a fertility specialist. But you can go to your gynecologist, and your gynecologist can refer you to a fertility specialist. When you get to the fertility specialist, we're going to discuss your case. We're going to rule out the likely underlying problems you guys might be having. So it can be male factor problem, it can be female factor problem. Sometimes you will not even know what the problem is, but you must consult a fertility specialist. So the very first question I will ask you right now, if you're attending today's event and you have not been able to achieve pregnancy, who are you consulting? Who are you talking to? Who are you telling your problems? Who is managing you? Is he a fertility specialist? If he's not a fertility specialist, then please change your ways. If it's just anybody that claims to be a doctor, change your ways. You can do better. So you can actually get these services if you're in our community. If you're in Nigeria and you intend to be connected to a fertility specialist, we can do that for you. All you need to do is to subscribe for 1 week, 1 month, 3 months, 6 months. Once you're done doing that, we can refer you to appropriate, evidence-based, caring, trusted, tested fertility specialists. Our results are out there. So I want you to succeed, but I want you to succeed doing the right thing. So the first thing, you need to consult this specialist. Now, when you're done doing that, when you get to the fertility specialist, we're going to run a lot of fertility tests. So you see, there are so many fertility tests we have to run for the woman. Of all the important tests you have to run as a woman that want to have a baby, the most important one is your ovarian reserve test. Every woman that intends to be a mother must have an ovarian reserve. Ovarian reserve is the quantity of eggs you have remaining in your ovaries. So that's the very first test we're going to run. If we run that test and we are convinced you have adequate number of ovaries that contain the eggs that will likely help you to become pregnant, then we're going to proceed. If we run the ovarian reserve test and we discover that it's really poor, then we're going to begin to think outside the box. So your ovarian reserve test is the most important test for fertility purposes. But we're also going to run your hormonal profile, fertility hormonal profile. We're going to check all your important reproductive hormones, estrogen, progesterone, FSH, LH, thyroid hormones. We're going to make sure that, okay, we're going to look at your tubes. We're going to look at the whole vaginal axis, the cervix, the womb, to make sure that everything is okay. Then we're going to look at your body weight. Then we're going to look at a couple of other things. We're going to rule out a couple of infections for the woman. Then for the man, we're going to do your whole complete metabolic panel, your complete blood count, but more importantly, check your sperm. So we're going to run seminal fluid analysis to check the quantity of the count of the sperm you have, to check the morphology, how good looking are they, and to check the motility, their ability to move. You see, if you have a good sperm but it's not moving, it's not going to get the woman pregnant. So those are the important fertility tests, which is number 2, which you must do. Please never go for this test by yourself. So don't take yourself to any lab. You go there, you say, oh, I want to do this, I want to do that. That's not the right way to go about it. You have to establish with a fertility specialist or a gynecologist, then we request the test. You go, when the result is back, they will send the report to the gynecologist or fertility specialist, then we interpret. After the interpretation, we'll make our diagnosis. After our diagnosis, then we'll begin your management protocol. Don't take yourself to the lab by yourself. This is a habit that so many people in Nigeria have been, going about doing. It's very wrong. You don't go to the lab, because the possibility that when you go to the lab, they will tell you stuff that will freak you out. For example, whenever you go to the lab, they will always tell you, oh, you have Staphylococcus aureus, you have Candida, and it's the reason why you're not becoming pregnant. And of course, it's not true. There is no association between Staph aureus. There is no association between Candida albicans and pregnancy. They are not connected. They are not related. They are not cause of infertility. So please make very important efforts to stop wasting your resources, going to the labs, doing the tests you don't need, creating unnecessary anxiety. Go through your doctor. Now, when you've done that, both for the woman and the man, for the month of March, decide to modify your lifestyle. There are so many lifestyles you're currently indulging in, and they are indirectly stopping you from becoming pregnant. There are so many women that do not exercise. There are so many men that do not exercise. The problem you might be having now might not be your ex, it might not be your sperm, it might be your body weight. If your body weight is not within the normal healthy range, it can affect your hormones. And when your hormones are affected, you will not be able to ovulate. You will not be able to have adequate sperm that will get the woman pregnant. So you need to modify your lifestyle. You need to live healthy. You need to eat healthy. You need to exercise. You need to drink only water. You need to avoid alcohol. You need to avoid smoking. You need to sleep. You need to get at least 7 hours sleep. These are all important lifestyle modifications that will help you. Pregnancy doesn't happen in a vacuum. Pregnancy doesn't happen overnight. You must pay for something to gain something. So you must pay for a good life to get the pregnancy and your family started. So avoid stress by any means possible. Avoid some harmful substances in the environment, which can also affect your ability to become pregnant. Now, when we've done that, you've established with a fertility specialist, we run fertility tests, you modify your lifestyle, then depending on your diagnosis. So your diagnosis is exactly what might be causing that problem. For example, if a woman has blocked fallopian tubes, we are gonna classify that blocked fallopian tubes. Is it bilateral blocked fallopian tubes? So bilateral means both tubes are blocked. Or is it unilateral blocked fallopian tube? That means one tube is blocked, the other one is open. We're going to know if it's severely blocked, if it's moderately blocked, or mildly blocked. If we confirm that both tubes are completely blocked, what are we going to do? We're not going to waste our time. We're not going to waste our money. We're going to immediately confirm and start going for IVF, because once the two tubes are damaged, you can no longer become pregnant naturally. But if one tube is damaged and one tube is still healthy, we can still try for pregnancy. So depending on your diagnosis, we are gonna, tailor and customize your fertility treatment. So your fertility treatment can be with drugs, things like Clomid. Your fertility treatment can be IUI, intrauterine insemination, or IVF, in vitro fertilization, or surrogacy, or donor egg, or donor sperm, or adoption. They are all fertility treatments. They are all the things we need to do to make sure you start your family. So fertility treatment is very important. Fertility treatment is customized. No two women can have the same fertility treatment. No two women can have the same pathology. No two women can have the same diagnosis. So some women might have fibroids, and the other person might have fibroid. And you say, oh, my friend have fibroid and I have fibroid. How come my friend became pregnant and I'm not pregnant? Because you cannot have exactly the same type of fibroid. Her type of fibroid might be subserosal, your own might be submucosal or intramural, and your own is unique. You might not have the same size. So stop comparing yourself with other people. Focus on you. But once you've done that, immediately commence the recommended treatment. Now you need to think outside the box. There are always alternatives to becoming parents. Becoming parent is a choice. Becoming pregnant is limited. There's a particular time you will get to as a woman, pregnancy will no longer be possible. But regardless of your age, you can always be a mother. So you have to have alternative pathways. There are some women that will stop wasting their time and money, and they have to get ready for IUI immediately. There are some women that need to get ready for IVF immediately. Unfortunately, there are some women that need to go for surrogacy. If for some reason your womb is hostile, your womb is not really allowing you to carry your baby, then we're going to cancel you. We're going to forget a lot of things about you. Then we're going to focus on another lady that will carry your baby. That lady is called the surrogates. So if for some reason your womb is not ready to be the vehicle that will bring forth your baby, but you might still have good eggs, or we're going to use donor eggs, then we're going to give your body a break. We're going to get another woman who is worthy, who will be the vehicle that will carry your baby. That process is called surrogacy. It's an option. So some women will need fertility drugs. Some women will need IUI. Some women will need IVF. Some women will need to go for surrogacy, and some women will adopt. Now, this is what I will tell you. They are all varied options. They are all perfect legal options. I want you to go above and beyond to start your family. You see, nobody will come and ask you, oh, did you get this baby naturally? Was it an IUI baby? Was it an IVF baby? Was it surrogacy? Was it adopted? It's because we talk too much. Nobody is interested in what you did to get your baby. The most important thing is that you're a mother, you're a father. But don't end your life wanting to become a mother, wanting to become a father, and you did not become, not because you didn't want to become, but because of your ways. Unfortunately, some people will spend the rest of their life without succeeding. Don't be that person. Don't allow anybody to deceive you. There is nothing wrong in IVF. There is nothing wrong in IUI. There is nothing wrong in surrogacy. There is nothing wrong in adoption. They are all important. Now, when you've done that, both of you must support each other emotionally. Emotional support is very important. Your partner, your husband, your wife, your mother, your father, your friends, you need that emotional support. It's your vehicle, it's the tool, it's the wind beneath your wings that will help you when you can no longer fly. It's important to get your emotional support. You can also join some groups. You can also go for counseling. You can also go to the same group of women that are looking for babies, like in our group. SGHS by default is a group of women that are looking for babies. So get that emotional support. Attend the events, come for master classes, get the optimization program. When you do this, you will be in a better place. You will see people that share the same problems with you, the same values, and you will be encouraged. You'll be motivated. Now, of course, you have to reevaluate your goals. So consider redefining what parenthood means to you. Some women will be like, oh, if it's not my egg, if it's not my sperm, if it's not this, if it's not my DNA, you are only gonna define your success. Nobody can define your success for you. So what you define as successful to you will be your own success story. You might not have the whole money in the world, but you're successful. You might have all the money in the world, but you have failed. So money and having babies might not be the criteria of defining your success. So redefine your goals. Find what you can define based on the two of you. Don't allow anybody pity you. Don't throw pity party. Don't go blaming people that have their babies and you think they're forsaking you. No. Redefine your goals with your partner. Explore alternatives to start your family. The earlier you start your family, the better. Especially if you're a woman and you're above age 35. When you get to age 35, your possibility of becoming pregnant is reducing because you have reduced ovarian reserve and you're classified as advanced in maternal age. You must think outside the box. And when you've done all this, you have to remember that it's essential to approach this journey with sensitivity, with empathy and support from a medical professional and loved ones, just like I'm doing now, because infertility is a very sensitive topic. There are so many women that are currently depressed. There are so many men that are going through a lot of anxiety. There are so many divided families. There are so many families that have gone through divorce simply because they have infertility. You must support each other. You must love each other. Infertility is one of the worst that can happen, but it's not permanent. The only permanent thing is your motherhood and your fatherhood. So that's my presentation. I'm going to open the clinic now to give you an opportunity to ask your questions. So moderator is in the clinic, but it's time for questions. If you have questions, use the next 10 minutes to ask your questions, and I'll give you feedbacks. Please go ahead. And Chinyere, if you have questions too, feel free to ask your question. So guys, it's time for your questions. Feel free and ask your questions. All questions are welcomed. Even if it's not related to this topic, feel free and ask, and I'll provide the feedbacks. Now, remember, every last Sunday of every month is our masterclass. So for the month of March, we are likely going to talk about gender selection. There are so many families that want to have baby boys, baby girls, and there are a couple of ways you can achieve that. We're going to teach you how you can succeed in having your baby girl and your baby boy based on your preference. It's called family balancing. There is absolutely nothing wrong in doing that, but some people go about it the wrong way. So save your dates. The last Sunday, Chinyere, please, can you tell me when the last Sunday of March will be? The last Sunday of March will be our masterclass. What age will be high risk for a woman to be pregnant? So here's the deal. When you actually get to age 35, you are considered as advanced in maternal age. That's actually when your risk factor for pregnancy will increase. Now remember, it's called risk factors. It means if we recognize you're likely going to develop hypertension, you're likely going to have miscarriage, you're likely going to have diabetes in your pregnancy because you're above 35, what are we going to do? We are going to monitor you closely. So all women who are trying, which we don't like using, we don't try, we believe, all the women that are praying and wishing to become pregnant, once you get to age 35, your risk profile will increase. So pregnancy from age 35 and above are riskier compared to pregnancy below age 35, simply for the fact that at that age, you have a lot of risk factors that might predispose you to complications in your pregnancy, including also difficulty in actually succeeding in becoming pregnant, because at that stage, you have reduced fertility, reduction in the quantity and quality of your eggs. So the age is 35. Okay? What's the difference between IUI and IVF? I love all these questions from Chinyere. So here's the deal. The difference is simply in the methodology. So in IUI stands for intrauterine. So intrauterine means inside the womb insemination. So most couples that go for IUI are couples that have no factor problems. So for some reasons, the penis is not really performing its role optimally. So we kind of get frustrated with the penis, and we're going to take over the function of the penis. So what we do in IUI, we confirm you've met the criteria. So the criteria for IUI is dependent on at least one open tube. So you have to have at least one open tube. And of course, you have to have good sperm. So those are the two solid criteria for going for IUI. So IUI stands for intrauterine insemination, inside the womb insemination. So we're going to check the man. We're going to make sure he's got good sperm. We're going to collect the sperm in a special instrument. Then we're going to confirm that the woman is actually, another criteria is to make sure that the woman is ovulating. So once the woman is ovulating, naturally, or maybe we give her ovulation induction drugs and we confirm that the tubes are open, or at least one tube is open, then we are going to target the likely time she's going to ovulate. Once we have an idea of about the time she's going to ovulate, we're going to collect the sperm from the man. Then we're going to inject the sperm directly into the womb. That's simply what IUI is all about. Injecting the sperm into the womb with the hopes that when the sperm get to the womb, they will begin their upward journey to the tubes, believing that the eggs will be in the tubes already and pregnancy will happen. Pregnancy happens in the tube. Pregnancy comes down to develop in the womb. Pregnancy doesn't happen in the womb. Pregnancy happens in the tube. You need to know the difference. Now, in IVF, which is called in vitro fertilization, is an example of assisted reproductive technique. So any type of fertility management that will involve handling the eggs and the sperm outside the body of the woman and the man is called assisted reproductive technique. So during IVF, we're going to confirm that the woman is ovulating, either naturally or we give her ovulation induction drugs. Then we're going to keep telling the ovary, say, you know what, we're not going to wait for you to give us few eggs. We want you to give us all the available eggs you have in this cycle. So we're going to give the woman some stimulation, some drugs that will go and stimulate the ovaries. While we are doing that, we'll be monitoring the ovaries, we'll be monitoring the cover of the womb, which is called the endometrium. Now, when we are sure that the woman has produced adequate eggs, we'll collect the eggs. When we collect the eggs, we're going to check the quality of the eggs. We're going to select the eggs we're going to use for the IVF. Then we go to the man. We'll make sure the man has adequate quality sperm. We collect the sperm. Then we go to the lab. The eggs we collected from the woman and the sperm we collected from the man, we'll join both of them together in the lab outside the body of the woman. When the eggs and the sperm come together, they will form embryo. Embryo is the starting point of all pregnancies. So the union of the egg and the sperm will lead to embryo. So when the embryo is formed, we're going to check the embryo to make sure it's good quality. Then we are going to schedule another appointment to transfer the embryo back into the woman. Once we transfer the embryo back into the woman, we're going to give her 2 weeks. After 2 weeks, she's going to go do her pregnancy test, and by the special grace of God, she's pregnant. Once you have succeeded in getting pregnancy test positive in IVF, at that stage, that pregnancy is equivalent to natural pregnancy. So that's the difference between IUI and IVF. In IVF, everything is done outside the body of the woman. Then we go back and put the pregnancy back into the woman. But in IUI, we take the sperm, we put it in the womb. Then when they get to the womb, they begin their upward journey to the tubes to see if they can lead to pregnancy. I love those questions. So the last Sunday is actually the 31st, and that's the Easter day. Wow. Well, we'll see what we can do, because I know you guys love your Easter. So maybe we might do our masterclass earlier than that date. We'll see. I didn't know it's exactly on the Easter day. I didn't really think about that. So we'll see what we do about it. We communicate with you guys, okay? How common is male infertility compared to female infertility? They're about 50-50. So about 50% of problems that might be leading to infertility might be coming from the man, and about the other 50 might be coming from the woman, and sometimes it might be coming from both of you. So I wouldn't want a situation where your partner is constantly telling you, woman, let me be. You're the reason why we're not able to have a baby. It's not true. Let nobody bully you. And it doesn't matter where the problem is coming from. You guys must support each other. Don't use your infertility challenge to attack each other. So there are some women that talk too much. Women are very verbal and very easily carried away with a lot of talk. So don't go attacking your partner. Look at you. Is it not you that caused this? You don't even have good sperm. And don't go attacking the woman. Is it not you that caused this? You don't even have, your tubes are blocked. So don't attack anybody, because you're practically attacking your family. Support each other. Go together. Make sure you submit yourself for investigations. There are some men that have sworn that they can never go for their sperm analysis. It doesn't make sense. The problem might be coming from your sperm. So submit yourself for sperm analysis. The woman goes for her own. Then when we discover the problem, we begin to treat you guys appropriately. Very important. Will a pregnancy conceived through IVF be considered as high risk? Not necessarily. Not necessarily. Once everything about that pregnancy is done okay, then pregnancy will continue just like natural pregnancy. The only factor that might come into play as a risk factor is your age. For example, if you're going for IVF at the age of 45, your age by default is already a risk factor. And a couple of other things that will happen around age 45 will already be a risk factor. The IVF process itself is not a risk factor. It's not an independent risk factor in pregnancy. But a couple of other things that happen in that pregnancy can be risk factors, of which your age is very important. So a woman that succeeded in having IVF at age 50 has a lot of risk factors compared to a woman that succeeded at the age of 30 or at the age of 40. So the older you are, the more the risk factors you will have in your pregnancy will increase. Okay? I love all these questions from Chinyere. Chinyere, thank you so much. And it looks like you're the only person attending today's event. That's interesting. I think people are coming and leaving, but that's okay. Just know that every Saturday about this time, we pick one topic, we dissect the topic, we help you to understand the topic better. Then we come back again tomorrow. So I have another clinic tomorrow. It's going to be in Facebook. Make sure you join me tomorrow, and then we'll begin the conversation. Okay, so I can see a question from Christina Ofo. Please, your doctor gave you injections to stop your eggs from growing in IVF. They affect your period, and your lining is not growing anymore since 3 times transfer cancer. What can you do? You're not getting the exact protocols, man. You're completely misquoting your doctor. Completely. And it's not good. It's not fair. You see, when you're going through treatment to become pregnant, whatever that doctor is doing is to help you, but you might not understand it. Or maybe when they explain it to you, you don't understand it. There is no doctor that will give you injection to stop your eggs from growing. It doesn't make sense. It's not done in medical school. It's not done in medical practice. It's actually the opposite. When we give you drugs during IVF, we are stimulating your ovaries to produce a lot of eggs. It's called stimulation. Your ovaries are going to go into super ovulation. Your ovaries are going to release a lot of eggs. We'll collect the eggs. We'll use the ones we're going to use. Then we store the other ones. At the time we are giving you these drugs, we're going to check the lining of your womb, which is called the endometrium. The lining of your womb must be thick enough to support pregnancy. So sometimes when we are stimulating you and it's not happening the way we want it, we cancel the IVF process. If your lining of your womb is not thick enough, we're not going to proceed. So it's not a must that, oh, once you start IVF, you're going to continue. So it's possible that's what your doctor is trying to do. So don't misquote your doctor. And I can't really help you much because you're not my patient and I don't have your medical record. So I can't really, give you like this is dates or this is start. The only thing I will tell you is this. IVF is a very special process, very expensive. So if you have to go for IVF, make sure that whoever is conducting that IVF is excellent, is an expert, he's got his results, and he's going to explain a lot of things to you. So if they have given you your report And if you're going for all those investigations, they should give you all your blood reports. They should give you all your ultrasound. They should give you all your partner's sperm analysis, your egg analysis, and they should give you a comprehensive IVF report. That comprehensive IVF report is what we will read, and we'll decide what we'll need to do differently. Unfortunately, sometimes everything will go okay and the IVF will fail. So IVF is not automatic. It's not guaranteed. You can go, you succeed, and you can go, you can fail. Very important to know that. So you need to go back and ask all these critical questions. And another thing is, I've noticed that some women just want to do what they want to do. Even sometimes what you might want to do might not benefit you. So there are some women that will have poor eggs, but they will insist, Doc, I want to use my eggs. I can't afford to use another person's egg. And there are some women that will say, my husband will never agree for donor sperm, but donor sperm is what will favor you guys. So if you're going for IVF, everything must be on the table, especially if you're in your 40s. All our women that are going for IVF at the age of 40 are always advised to consider donor eggs, because at the age of 40 and above, possibility that your own eggs will succeed in IVF is limited. So we always advise you to go for donor eggs if you're going for IVF above age 40. Okay? All right. And Christina offer, if you want to join us, you can get a package and I can review your case and I can refer you appropriately to an excellent IVF provider. If you want to do that, that's an option. Okay. Chinyere is asking very simple, important question. What's the difference between a gynecologist and an OB-GYN? So Chinyere, what you asked is a component of the other one. So OB-GYN is a combination of obstetrician and a gynecologist. So a gynecologist is a special doctor trained in the issues that border on women's problems, especially reproductive problems, everything that has to do with women issues, everything, your menstrual pain, your this, your that, that's the sole jurisdiction of a gynecologist. Now, an obstetrician is a doctor of women that mainly specializes in helping women that are pregnant to make sure they give birth to their babies without problems. So here's the deal. 99.9%, if not 100%, a gynecologist is an obstetrician. Then some of them will decide to go into a particular area. Like a fertility specialist, first of all, is a gynecologist who now decided to focus on just the aspect of infertility and forget other aspects of gynecology. So gynecologist and an obstetrician, they are one individual performing two different roles in the same part. So you can't extricate the two components. So that's the difference. Okay? All right. Do we have any other question? If you have any other question, please feel free and ask before I go. But thank you for coming. My next clinic in YouTube will be on Saturday, just about this time. But I'll run another clinic in Facebook tomorrow. Chinyere, thank you so much for all those questions. And I'll see you guys. And remember, if everything fails, God will not fail you. You're going to succeed. Start your march on a different level so you become pregnant early. And by the special grace of God, God will attend your party. So thank you for coming. Enjoy the rest of your evening. And until I see you guys tomorrow, God bless you and bye-bye for now.